There have been a number of times they have hotlined a patient with surgery on appendicitis. They've removed the appendicitis and it looks nice and pink and healthy. And then the surgeon says, oops, my bad. And of course the patient doesn't like that. The way that you can confirm the diagnosis is if you can possibly do it. Run a stat CBC. Run a stat blood count. Okay? If you find one type of blood cell, it's called a white blood cell, if you find those cells elevated, you've got your appendicitis. That's the confirming one. Everybody usually just does the rebound tenderness. And sometimes you get it, sometimes you miss. So, but that's how you end up getting that rebound tenderness. So that's in the lower right quadrant. All right. So if you were complaining of a gallbladder attack, all right, well, this green structure right here kind of looks like a pear. Okay, that's the gallbladder. And sometimes this may become inflamed, and you may actually have this duct right here blocked. And the gallbladder is trying to compress to release the substance, and it can't do it. And so it starts to swell and become inflamed, and your patient now is saying, oh, jeez, I got this terrible pain, and it's right here. I don't know what it is, maybe something I ate. Well, no, chances are what you got is patient presents with a pain in the upper right quadrant. And that could be a possible gallbladder attack. Okay? And then you go to the left upper, look what is in here. The majority of this one here, this is the stomach. So suppose now you have a patient that comes in and says, geez, you know, boy, I have this burning pain, and I don't know what it, they may very well have an ulcer, a gastric ulcer in here that's caused by a bacteria. So you can cure gastric ulcers very easily. You just put the patient on a course of antibiotics, a 10-day course of either Prilosec or Tagamet or something, and then Pepto-Bismol as needed. And within 2 weeks, the patient's fine. Upper left quadrant, or left upper quadrant, there. And then finally, left lower quadrant. Now, what you may find, and this is the more common thing, is that because it's an intern that's making the notes, or even a resident that's making the notes on the initial, exam, they may end up just abbreviating. So you may have, again, that patient with appendicitis. You may see a patient, a 59-year-old white male, presents with pain located RLQ. And you'll look and say, RLQ, I don't remember an anatomical structure, RLQ. Right lower quadrant. Okay, I'll just abbreviate it. Okay. This is the one that is used 99% of the time. Very simple, straightforward, easy to get particular locations. Now, suppose you end up getting a job with this 95-year-old chief of medicine who doesn't know enough to retire. All right? So what you'll find is you're going to find, and he says, doggone it, I went to medical school in 1912, and we learned not quadrants, we learned regions. And doggone it, you're going to make your charting by regions. All right. Quadrants, 4. Regions, you got to think this way. And the first thing, as soon as you hear the word region, I want you to think of tic-tac-toe. Okay? Look at what you got here. You got the grid for tic-tac-toe. So immediately, as soon as you hear the term regions, you've got to identify a region. You draw a tic-tac-toe grid. And what you can count is you're going to see, gee, 1, 2, 3, 4, 5, 6, 7, 8, 9. There are 9 regions. And you'll say, oh my God, 9 regions, I'm never going to remember this. No, you only have to worry about 6 of them. Okay? You only have to worry about 6 of them. Because they're the same names on either side. The only difference is right or left. So all you have to do is know one set on one side. And the opposite region, well, that will be the right side. If I've got I got the left side, well, that'll be the right side. Okay? So you only really need to know this one and this one here. So 6 out of the 9. But you know how to place them, or you'll learn how to place them if you remember about tic-tac-toe.